Hi, this is Dr. Paul with CarInjuryCare.tv, and we answer the most common questions regarding auto accident injuries and questions in medical, legal. And we're talking with Dr. Nick Venturino here in North Tampa. And the question we're talking about today is physical medicine, whether or not you would need physical medicine for a car accident. So let's talk about that just a little bit. What happens typically when a patient or a potential person's in an automobile accident? So they have a physical injury, and what's the difference between getting physical medicine versus medication?
Obviously, medication is, the purpose of medication is to help alleviate pain or symptoms. So the medication will block specific pain receptors so that you don't feel the pain. However, pain is not a problem. Pain is a side effect of a problem. So if the problem is deeper, like a disc injury or a joint injury or nerve damage, the pain medication may block the pain, but it doesn't do anything to fix the physical problem, which is the joint problem, the disc problem, or the nerve injury. So if you're not utilizing physical medicine to help with a physical problem, all you're doing is covering it up, masking it with medication. Now, that's not to say that the medication won't make you feel better, or even muscle relaxers won't help relieve some of your symptoms from muscle strain and sprain. However, they're not doing anything to improve your movement or how your body functions on a day-to-day basis.
Let's talk about that just a little bit. So, because I know it's so common when somebody's in an accident or when they have pain to take pain pills.
Sure.
That's just the American way. That's the way it is. But let's say they do have a physical injury. In other words, they don't have an infection, flu, something like that. They do have a physical injury with the ligaments, the tendons, the muscles, something like that. So what specifically is the difference between getting physical care from a chiropractor versus the same type of person only taking medication? Walk me through that.
Medication, like I said, is going to mask your pain, but your body heals by itself, always. Whether it heals correctly or incorrectly depends upon the treatment that's received. So if you have a physical injury, you have a torn muscle, you could take pain medication to make the muscle not feel bad, but it's still going to be weak because it was torn. It's still not going to function normally, maybe not move properly because it was torn. So if it heals incorrectly, it's going to heal with scar tissue, and then you will permanently not have normal movement or normal range of motion. You may always be limited in strength because the tissue healed improperly. So if you get the proper treatment for that, and you can actually cause the muscle to heal normally, well, then you're going to get more normal range of motion out of it, you'll get more normal strength out of it, more normal function. As a byproduct, the pain will go away as the function returns more to normal. So physical medicine for a physical problem is going to help with the function, range of motion, and the pain, versus just masking the pain and then causing your body to heal abnormally with all the negative side effects of being more stiff, being less weak, less strong, and more easily injured because of the way it healed.
So you not only, what I'm hearing you say is you not only help with the pain, but you actually help to increase the person's strength and range of motion and their mobility of that damaged tissue. Is that what I'm hearing?
More importantly for the doctor is correcting that function. But by the way, we also help what's most important to you as a patient, which is your pain. The pain will go away as the function becomes normal, versus always needing another painkiller, or maybe two, or maybe a stronger dose to get the same level of relief over a period of time.
Well, I'm sure, in the United States it's real common, pain pills, it's pills, pills, pills for everything.
Correct.
So in your experience, how often are you seeing patients come in that did not seek physical medicine after a physical injury like a car accident? They just went and got medication from their primary care doctor, and that's all they did. And then maybe weeks or months later, now they're having problems. How often does that scenario present itself?
I will tell you, in my 10 years, 100% of the auto cases that come into my office, of the ones that went to the hospital, 100% of them were told, they were examined in the emergency room and told, you've got strain and sprain in your muscle, and take a couple of pain pills, a couple of muscle relaxers, and you should be fine in a week or two.
And so there's-
100%.
So no follow-up with restoring the person's strength or range of motion or any of that?
There's no need, because they just strained their muscle, they're not really hurt,
Okay,
is what they were told at the hospital.
okay. And then I take it they eventually see you because they're still having some sort of problem?
Or chronic problems, yeah,
Okay.
because things have healed improperly, and then they need my
Okay.
services a lot more.
So what I'm hearing you say is that's more the case than not the case. That's what
Absolutely.
happens. And what can you do for that person? Let's say that that's the scenario. The person's in an automobile accident. They go to their GP at the emergency room. They're told that they have a mild strain, take these medications. And then say months later they come in your office. How can you help them differently?
Well, we have to work on the actual cause of the problem. Inflammation in the joint, pressure in the joint, potential damage to a disc. So first off, we do our thorough examination to find out exactly what's causing their symptoms. And then we tailor a treatment plan specifically predicated on resolving the problem, which would be the joint pressure, the damage to the disc, or the nerve pressure, versus just trying to make them feel better. Ultimately, we want them to feel better, but we design our treatment around trying to increase their range of motion, increase their muscle strength, to be able to bend and twist and lift more normally, naturally, versus having to, compensate because you can't turn one way, so you do something else which is going to cause a problem in a different area to try to accomplish your goal of lifting or bending or whatever the case may be.
That makes sense. If you could describe, how would you do that as a chiropractor? How would you help somebody's increase their range of motion, how well they move, or their mobility and strength? Can you describe that? How would you do that?
If it's specifically caused from joint pressure, nerve pressure, we would work on alleviating that nerve pressure. Gentle manipulation to take the pressure off of the joint, which helps reduce the swelling in the joint, which helps take the pressure off the nerve. We would do some therapies, like mechanical traction, which literally gently stretches each bone in the spine apart, takes some of the muscle tension off, but it also helps with the inflammation and the pressure in the joint. We would do some electrical stimulation, which specifically helps reduce inflammation in the joint. But it also helps loosen the muscle up so there's not as much spasm, not jamming the joint together as tightly. And so all of the treatment is to help inflammation, joint pressure that's causing nerve pressure. So the patient will feel better very quickly, but most importantly, it will help with their movement, their more normal movement, and muscle strength.
And that is the difference you're saying between physical medicine, physically treating the anatomy, versus just taking medication.
Correct.
And what kind of success rate do you have with something like that?
Me personally, or chiropractic in general?
Maybe both.
I mean, chiropractic has a 94% overall approval rating. When they're asked little relief, modest relief, good relief, great relief, total complete relief, we're at that 94% range from total to great relief. I mean, chiropractic is extremely effective doing what we do. And I would say my office is probably right up in that 94–95% success rate with those types of conditions.
So you definitely can help somebody that's been in an accident. I take it there's, to some degree, how soon after the accident they saw you is how much you'd be able to help them. Is that a fair statement?
Sure. The sooner we get to you after the injury, the faster we can stop the natural progression. Like I said in an earlier video, healing is your body's always going to heal itself. Whether it heals properly or improperly depends upon what type of treatment it receives for a particular problem. So the sooner we get to a problem, the faster we can cause it to start healing normally versus abnormally with scar tissue. So much more success if a patient comes in recently after the injury or the trauma versus waiting 3, 4, 5, 6, 8 months.
And even if they did wait 3, 4, 5, 6 months or a year or two, is there still a chance you can help them?
Greatly. Just typically not as much as if we got them early.
Okay. All right, well, good. Well, that makes sense. So that's the difference between physical medicine and medication. Again, this is carinjurycare.tv.